So my name is Alexa Wright, and I'm going to be performing the central venous line skill today. Bear with me, I don't have anybody to record, so I'm trying to record this myself. So first, I'm going to state my 10 rights. I'm going to verify the care order for my patient, verify facility policy and procedure, gather the appropriate equipment and supplies, perform hand hygiene before and after patient care handling equipment, consult manufacturer's recommendation when equipment is involved, knock on my patient's door, identify my patient using 2 identifiers, note the overall condition of my patient, explain procedure, provide for privacy, elevate the bed for good body mechanics, don PPE if indicated, and then upon completion, lower the bed, place the call light in reach, and raise the side rails according to my patient's care plan, and then report any information to the charge nurse that needs to be reported. And if I'm in clinical, wherever doing an IV push, I need my clinical instructor present while I do that. So for my cardiovascular assessment, I'm going to first obtain my patient's vital signs and then obtain the rhythm strip if available. I'm going to assess my patient's cardiovascular history. So I'm going to ask her, have you previously had any cardiovascular problems? Run in your family? Have you had any procedures? What is her cardiovascular history? So just if she's had chest pain like this before, if she's complaining of anything like that, has she had chest pain before? Does she smoke? All of those things that I can learn more about my patient's cardiovascular history. I'm then going to assess the symmetry of my patient's chest. I'm going to inspect that. Then I'm going to identify my patient's cardiac landmarks. So since I have a teddy bear, I'm going to show you on me today. So on my right side, we have the aortic area, which is the second midclavicular line on the right side. Then on the left side, we have the pulmonic, second intercostal space, midclavicular line. Then we have Erb's point, which is the third intercostal space on the left side. Then we have the tricuspid, fourth intercostal space, left side. And then the mitral, fifth intercostal space, midclavicular line, left side, which is also the point of maximal impulse. So I'm going to listen to all of those landmarks on my patient using the diaphragm and the bell of my stethoscope. I'm going to note any adventitious sounds. I'm going to listen for S1 and S2 heart sounds. And if I'm having trouble hearing that on my patient, I'm going to lean her forward or laying on her left side so that the heart is closer to the chest wall and I can hear it better. So then I'm going to assess and grade her pulses. So we have the temporal pulses and then the carotid. I'm going to do the carotid one at a time, not at the same time, so I don't make her pass out. Then I'm going to do the radials at the same time, the femorals, the popliteal behind the knee, the posterior tibial, and then the dorsalis pedis on top of the foot. I'm going to grade those, know any difference between extremities, how strong are they, anything like that. So then I'm going to inspect and look at her extremities from left to right. Just are they cyanotic? Are they Ruber, Pallar? How do they look? I'm going to note the temperature of those extremities, know any differences in extremities. Then I'm going to assess for central or peripheral edema. And then I'm going to note if there's any weight gain in her. Has she had any weight gain lately? Anything like that. I'm going to assess for hypotension or paradoxical blood pressure. So if her blood pressure decreases on inspiration or anything like that, I'm going to note that. And then I'm going to document, chart, or report any information that I have found that needs to be. So that's it for that part of it. So first, I'm going to do the dressing change for my patient. A lot of this I'm just going to have to verbalize because it's a teddy bear. So first, I'm going to let my patient know what I'm doing. So we have to do a dressing change today, Miss Teddy. Got to get you a clean dressing on there. So I'm going to go ahead and I'm going to put my gown on. Okay, so I've got my gown on. I'm gonna go ahead and ask my patient if she can put her little mask on. I'm gonna let her know that she needs to turn her head away while I change this dressing. I'm gonna put my mask on. All right, so we've got that. I'm gonna put on clean gloves. Okay, so when I'm taking her dressing off, I'm going to pull from out to in. I'm going to pull that off. So let's say I've got pulling it from out to in. Her head is turned away. Got the dressing off. I'm going to look at it and I'm going to know any discharge, the color of the discharge, if there's odor. I'm going to assess for any infection, if there's bleeding, what the dressing looks like. So I've got all of that. I'm going to take off my clean gloves, discard of that dressing per the facility's policy. And then I'm going to go ahead and prep my sterile field. So I've got my sterile drape. I don't have much room to work with here. All right, so there's my sterile drape. I'm going to open my dressing change tray. Dump that. Okay. Let's see where I'm going to put on these sterile gloves. All right, I'm going to grab these. Put them on right here. All right, so I'm going to put on my sterile gloves. Okay. I think my hands might be a little too big for these guys. Okay, so I've got my sterile gloves on. Okay, so first I'm going to take my ChloraPrep, and I'm going to clean my patient's site from in to out. I'm going to clean over the catheter tubing, make sure I scrub that really good. So let's just say we're cleaning from in to out. And then I'm going to make the area pretty big since that's where my tegaderm's going. And then I'm going to discard of that. If I didn't have the ChloraPrep, I could use iodine if she wasn't allergic and then complete that with alcohol. So I'm going to take my tegaderm. I'm going to place it nicely over the site. And then got that taped on. I'm going to initial date and time the tegaderm. If she would have had anything drainage-wise on like the dressing, anything that needed to be reported, I would report that. And then also like document my findings, document that I changed the dressing. So that's it for that one. I'm going to go ahead and clean up this area. I don't have a whole lot of room to work with. So, okay. So for the second one, I have to have my gown on as well. And I'm going to access her port So I'm first, again, going to tell my patient to put her mask on. I'm going to have my mask on. I'm going to put on my clean gloves. Let her know what I'm doing. Like, you've got to get some medication today or your chemo treatment. Like, whatever she's getting, I'm just going to let her know why we're doing this. Alright, so I've got my clean gloves on. And I'm just going to feel where her port is. So I'm going to note the top and the bottom of the port. Feel where it is so I know. Okay, so I've located that. I'm going to go ahead and put on my sterile gloves and get my sterile field ready. So again, I've got my sterile drape. I'm going to go ahead and open this up. I have my sterile gloves to put on. Okay. So this was from my dressing change kit. So I'm going to go ahead and dump that stuff on there. Don't fly off. I'm going to throw on a Luer lock. And then I've got I'm going to go ahead and just get this ready. I will not put that on my sterile field. Put that. Okay, I think that I have got it all. Okay, so I'm going to go ahead and I'm going to put on my sterile gloves. Sorry guys, I'm not working with a whole lot of room. Alright, get these gloves on. These are a lot better than the last ones, that's for sure. Okay, so I am now sterile. This is probably in your way, so I'm just going to go ahead and toss that. Okay, so I've got my ChloraPrep, and I'm going to clean the site from in to out, as big as like where the Tegaderm is going to go as well. And I'm going to discard of that. Okay, so I'm going to go ahead and I'm going to fill the top and bottom of the reservoir, again, to make sure that I know where that is at. And I'm going to go ahead and I'm going to place my Luer lock on my tubing. It's all clamped. Okay, so with my non-dominant hand, I'm going to fill the top and bottom, and then I'll insert this at a 90-degree angle, just like that. And I'm gonna do it until I fill the back of the port. Sorry if you hear my cat meowing. So I've got that inserted, and then I'm gonna immediately place my Tegaderm on top. Just like that. And you know what? I may just make life a little easier. Okay, so we've got that placed. Now my sterile part is over. Let's see if I can get you guys closer. Okay, so I've got this all done. Pull this off. I'm gonna initial date and time that. Okay, discard. So first, I'm going to go ahead and I'm going to scrub my hub. So I've got my alcohol pads, and I'm going to open that and I'm going to scrub the hub. And then I'm going to get my 10 milliliter syringe and I'm going to attach that. And I'm going to pull back. What I should be pulling back first is the air. So that'll prime my tubing. So I pull back the air, and then I'm gonna pull back, it should be clear, which is the heparin, and then blood tinged. That means I know that my placement is correct. So I've got that all pulled back. So I'm gonna disconnect this. And then I'm going to get my normal saline. Gonna open that. Make sure there's no air. And I'm going to connect that. So I've got my normal saline connected. And I'm gonna flush this 5 cc's or whatever, 5 or 10. Flush, flush, flush. It's patent, we've got it all good. And then I can leave this connected and I can initiate the IV fluids that the physician ordered. So I can connect that, or if we just needed it to be placed for sometime today, something's happening, I can disconnect this and then I'll clamp and she's good to go. So she's got her port all there. Okay, so now I have got the order that she's good to go. She needs to go home, so I'm gonna go ahead and de-access her port. So what I'll do is I'll have clean gloves on. So we can just say these are clean. So these are clean gloves. So for this one, I'm gonna go ahead and I'm gonna pull back the Tegaderm, loosen that, stop the IV fluids that she had running. If she had any running, I'm gonna stop that, clamp, and I'm gonna go ahead and pull back this dressing, which, you know, I don't know how well this is gonna work to take off of this tape there. Okay, there we go. So we're gonna pull from out to in, loosen that up. Okay. Before we do that, I'm not going to do that first. Before we do that, I'm actually going to verify my placement. She had IV fluids running, but I'm still going to verify. So I'm going to take a syringe, going to get my alcohol pad, and I'm going to scrub the hub. Going to attach this. And I'm going to pull back 1 cc, so I'm going to get blood. Then I'm just going to go ahead and flush the rest of this normal saline. So that's what I'm going to do for that one. I'm going to go ahead and leave that normal saline connected. I'm going to get my heparin. And I'm going to connect my heparin. We verified placement. Get that heparin connected, and I'm going to put the heparin in the line. Okay, so we've got the heparin in. Perfect. Okay, so now that that's done, I'm going to reclamp the tubing. All right, and then we're going to pull the dressing from out to in. Hope you guys can see. All right, so we got that dressing pulled back. It's quite hard on a fuzzy patient. Okay, So when I pull out my needle, I'm gonna probably just get a little bit of pressure, and I'm gonna pull out at a 90-degree angle, and I'm gonna discard this for my facility policy. And I'm going to take my Tegaderm and I'm gonna place it right over that area. Bandage it. The bandage is gonna be per my facility's policy, so I'll like bandage that per my facility's policy. And then I'll chart what I did. Okay. I'm gonna move you back now. I'm gonna take the dressing off her. Okay, so we've got that done. I'm gonna go ahead and take this off. So now, my patient already has her central venous line there, and I have just got an order to do a, we need some blood and she may need some medications. So we're gonna do that. Okay. Let's get some trash. I'm gonna get my supplies for that one. Okay, so she's got some fluids running right now. I'm gonna go ahead and stop those fluids. See if I can get you there. Okay. So I'm gonna stop her fluids. We stopped those. I'm gonna put on my clean gloves. Let her know what we're doing. So, Miss Teddy, your physician wants some blood samples on you so he can get CBC, check kidney function, whatever he needs to do. We just need to get that blood drawn. So I'm gonna, got my clean gloves, stop the fluids. I've got my alcohol pad. I'm gonna go ahead and open this up. We're gonna go ahead and open this up as well. Okay, so I'm gonna take this and I'm gonna scrub her hub, maybe like 30 seconds, get it nice and clean. I'm going to place my normal saline, flush with 5 milliliters, make sure we got that all nice and done. Flush that. Okay. So then I'm still holding her tubing. I'm going to place my 10 ml syringe and I'm going to pull back 10 milliliters of waste. All right. I've got my 10 milliliters of waste. I'm going to discard of that per my facility policy. I've got my other syringe. Oh, I just let go of my tubing, so I'm going to go ahead and scrub the hub again with my alcohol. Okay, so I've got this on. This is going to be for my blood sample, so I'm going to pull back 10 mLs or however much I need for that. All right, so I've got that. I'm going to set this, and then I'm going to connect my normal saline. And I'm going to leave that normal saline connected. So for my 10 mLs of blood that I got for my sample, I'm going to put this in the correct vial. I'm going to date it, initial time, and I'm going to send it to the appropriate place that it needs to go to, whether it be lab or whatever. I'll have that done. So I have my normal saline connected. I can go ahead and flush my normal saline through. I'll flush that, and then whatever the physician had ordered for my patient, I'm going to take this off. So if he ordered a blood pressure medication, I'm going to let her know, okay, this is for your heart, this is for your blood pressure. I'm going to connect that, and I'm going to flush it at the prescribed rate. So flush, 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 prescribed rate. Disconnect that, and I'm going to go ahead and hook up my normal saline again, and I'm going to flush this at the prescribed rate as well. So I'll flush that over the prescribed rate. Okay, and then she's got another medication. Maybe it's her Lasix, so I'm going to connect that. Flush at the prescribed rate. Disconnect. I got my normal saline. I'm going to connect. Flush at the prescribed rate. Okay, so then I have that. So if she's got IV fluids or anything that she needs to be rehooked up to, I'm going to go ahead and do that. If not, I will clamp it, and then I will chart everything that I just did, the medications I gave, how the patient tolerated, all of those things. I'll chart that. I took the blood, got the blood sample, and to where I sent it to. And I think that that's it for this skill. Sorry for the awful quality of the recording. Thank you.